nursing is a highly regulated profession. We have accreditation standards and regulatory standards that we need to meet. On a good day, nurses go home from work feeling as though they didn't have enough time to do the work they needed to do every day. So there's a lot of pressure to get it done and get it right. The act of putting on all that gear to go in and out of a patient's room that's isolated with COVID takes time. And it's time that they don't have to do the work. There's no extra personnel. So they are under a lot of stress and increased work compression because of the pandemic. 80% of our workforce, at least 80%, is female. And anyone that's got those children home from school is supposed to be homeschooling them. How is that happening with these frontline workers at work for 12 hours a day, or sometimes even hoteling it to keep their families safe, right? I've heard many nurses, even if they do go home, they're sleeping in separate bedrooms so that they don't infect their families, and their husbands are leaving a plate of food at the door. So how is all that working? How are they getting the support they need during this time? I think the public should understand that we've heard a lot of analogy about this being a war and that the nurses are heroes. Well, they didn't sign up for a war. They signed up to cure and care. I'd point them to the American Nurses Association website. Once you get to the ANA, just put in mental health and you will find a whole list of resources to be used either at the individual level or the organizational level. Those resources were compiled by a task force called Strength Through Resiliency that was formed immediately when the pandemic hit. So it's geared specifically for this event to help you through this. And the Healthy Nurse, Healthy Nation also has a whole host of resources available for you at that site. Organizationally, though, I think we really do need to take a moment and say, what are we going to do to help protect the mental health of our nurses at a leader level? We know that nurses were at risk for suicide before this whole pandemic started and had been at risk for many years, and that nurses were feeling work compression for a long time, feeling like they couldn't get the work done in enough time. So there are prevention strategies that can be replicated and upscaled immediately for very little money. I encourage executives to contact the American Foundation of Suicide Prevention and talk to them about their risk screening program. You can easily detect nurses at risk and get them the treatment they need. Lastly, I think we all need to do peer support. We need to be able to recognize someone who's lonely and stressed. Loneliness is a very big risk for depression and suicide. And if we connect with each other during these times more than we ever have before, we can help protect the mental health of our workforce.